With me I've got Dr Larry Benge. Larry, just how far has advanced dental care, or as they now call it, oral rehabilitation, come in recent years in relation to dental implants?
Stephen, there's been a dramatic change over 20 years. The time it takes to actually commence and start a case has been greatly reduced. We're able to do a lot of cases today that we weren't able to do before without extensive bone grafting, which is more traumatic for the patient. Technology has really increased and it's actually caught up to us. So we have actually computer-generated programs where we can actually plan where we're going to place the implants before we even start the case. And the advancement in radiology has been quite immense. We've gone from two-dimensional images to three-dimensional, which means we can actually get a representation of a skull in 3 dimensions, so we can actually see how much bone we've got before we even start, which can alleviate any potential problems during the procedure.
Now I want to ask you about one of your exciting new procedures in Australia. Can you tell us more about all-on-4 implants?
It's a very exciting thing, all-on-4, Stephen, because patients previously either couldn't have implants unless they had to have bone grafted, and that bone was either taken from the hip or other parts of the body, which was particularly uncomfortable. The all-on-4 system relies on 4 implants being placed, and the 4 implants avoid vital anatomical structures, which means it's less traumatic for the patient. We can put longer implants in than we previously could place, and the number of implants placed is reduced because 4 is the standard, whereas originally 6, 7, 8 implants were placed.
Does this make the bone graft a thing of the past?
In many cases it does. Obviously there are still cases that will need bone grafting if they're doing singles, doubles or 2 or 3 implants, but for full arch rehabilitation, and that's for patients that have lost their teeth and are wearing dentures, or patients that are about to lose all their teeth and their only treatment could be to wear dentures, for those patients the all-on-4 is a much easier procedure.
Just how easy is it?
Well, it can be done under local anaesthetic. It can be done if you're particularly nervous under local anaesthetic with sedation. Some patients even choose to go for a general anaesthetic. The operation time is about an hour to an hour and a half of actual surgical time. And in many cases, we can do it without even raising the gum. So we do it as what's called flapless surgery, which means less pain, less swelling, quicker recovery.
Talk about the time frame. How long do patients have to wait to get their final teeth?
Well, originally, the patients, if you had bone grafting and went through those procedures, it could take 9 months before you actually got your final set of teeth. With the all-on-4 system, we can have your teeth in as little as 2 to 3 days.
It sounds impressive. Is it expensive?
It is expensive, but in relation to other procedures of dental implants, it actually is the most cheap form of dental rehabilitation because you're using less implants and therefore the cost has been reduced.
What cases or ages are best suited to this procedure?
All cases are amenable to it as long as you are a healthy individual. Obviously, if you are a child, you wouldn't be in that sort of situation where you haven't completed growth. But I've recently treated a 93-year-old. So age is no limitation. Obviously, you need to be in good health to have a procedure done, and we do a thorough medical assessment before you have a procedure.
So how close do your patients feel to their new teeth?
They love them. Because they feel a great deal of confidence, because all of a sudden, instead of wearing dentures where they have reduced chewing power, which are often painful, they can't go swimming, they have teeth that they often comment that we can go swimming, we don't have to worry about losing our teeth. You know, my chewing, I've got no pain when I chew. So the other thing it does is it can give improved facial aesthetics, because as you know, when you lose your teeth, you lose bone. And a lot of patients get their chin and their nose getting closer together. And when you're making dentures, you can't actually put the teeth where you want to. So with the all-on-4 implant system, and when teeth are screwed in, we can actually enhance the patient's profile, their aesthetics. So they love it.
Fascinating stuff. Next time we're with Dr Larry Benge, we might ask you to perform a live all-on-4 procedure.
Be a pleasure, Stephen. Thanks for being here.